Dr. Purcell, you led the research that went into the APHI Phase 2 report covering risk mitigation around COVID 19 in airports. Can you tell us what that entailed?
Yes, that's right. I led the survey and the interviews with all the airports in the study, and I also represented our team at all the various working groups where we came together with the different membership organisations with the airport operators. So it was a lot of work. We surveyed 23 US airports and two outside the US, and then we interviewed managers of 6 different US airports and did field visits to 2 airports in the US as well. We also spoke to the Transportation Security Administration, to Customs and Border Protection, lots of different associations that represent the airport industry, specialists in virus testing, ventilation and indoor chemistry, and cleaning and disinfection, and we spoke with airport architects as well. So there was a really comprehensive questionnaire, follow-up interviews, lots of sharing of materials with us. In fact, the airports were very generous with their time. And maybe if I just give you a sense of the volume of materials that we reviewed, about 1,500 pages of completed questionnaires and supplementary materials and 5 full COVID playbooks. I'm very grateful to the airports that participated. So I think we have some really good insights into the major protocols and operations that we're talking about here.
What did you learn from the survey? How are airports doing generally with managing health safety around COVID 19?
Airports are doing well. They really are across the issues, navigating the science and working hard to mitigate the risk of viral transmission as we traverse the airport or work in it or visit just to meet and greet. We found that all the airports in our study are making concerted efforts to reduce the risk of SARS-CoV-2 transmission in the airport environment as it relates to this curb-to-curb traveller experience. They're employing a whole range of risk mitigation strategies for passengers, employees, concessionaires, contractors and visitors, and typically these interventions fit with what we know about how the virus spreads, and they include the enhanced cleaning and disinfection, upgrades to ventilation and air handling, means to encourage physical distancing, promoting compliance with wearing face masks, and using technology to support contactless procedures in certain circumstances. So I think collectively these efforts are playing a really important role in providing these layers of protection and risk mitigation. So our sample looked at US airports across a whole range of different areas of the country, different sizes of airports, those with international and or domestic facilities. So while there are no 2 airports that are the same, we believe the sample offers a substantive basis upon which we can really assess the kind of pandemic practices that are open and make some recommendations that are relevant.
There is a real concern from the scientific community, including the President's COVID task force and the CDC, about the new strains and their infectivity. How do these new strains affect your recommendations?
I think that's right. We do seem to be in a race now to get vaccines into arms and reduce the overall spread of the virus. Variants are a common way a virus tries to outwit our defences, and the longer the virus is out there in the community, the more the opportunity for variants to emerge. What we found was that airport mitigation strategies showed a substantive grasp of SARS-CoV-2 transmission routes, with interventions designed to reduce spread by all known routes. So I think the backdrop of the variants simply reinforces the importance of our recommendations and following the science as we look to reduce transmission risk. And this is even more important where variants are better at spreading, making this layered approach we talk about even more critical, and of course, compliance with the science.
What are the major protocols, operations, and or features that airports are doing or should be doing to reduce risks of SARS-CoV-2 transmission?
Let me take one example. An airport that noted it had installed over 2 miles of barriers It added 5,000 floor decals, 2,500 signs, 500 hand sanitizer stations. And it also makes announcements in 2 different languages every 10 to 15 minutes. It's enhanced its cleaning and disinfection, and it's reviewed its ventilation and air handling systems. What we found was that innovation in the sector is strong with the adoption of these contactless technologies, sensors and automation. So from the use of mobile phone apps to order food or reserve a time slot in security lines, to the use of sensors to monitor passenger flows and carbon dioxide levels for ventilation, robot cleaning and disinfection, airports are innovating. They're also sharing the lessons that they're learning through their membership associations, their industry bodies, and they're investing in education and training. So given the risk of SARS-CoV-2 spread by aerosols and droplets, the leading mitigation strategy was the use of face coverings and masks. Compliance was monitored by staff. In fact, some airports had a travel well ambassador or a guest champion. Others used their security staff and on-site police officers to promote compliance. To support the efforts to reduce the risk of viral spread by inhalation, most airports had installed clear barriers and screens at locations where employees and passengers interact face to face. This was mostly entirely appropriate, but some were also extending these in certain locations that could interfere with effective ventilation, that could in fact exacerbate the risk of transmission. And we talk more about this in our research on modelling that's in the report, I think it's chapter 7. Physical distancing was promoted actively at all the airports we surveyed, using digital and physical signage and regular public announcements to support compliance. We saw a range of contactless technologies in use before, obviously, the COVID-19 pandemic, but the crisis was really providing an impetus for further investment and adoption of digital technologies. In fact, one airport mentioned that it would be possible to complete the curb-to-curb journey almost entirely contactless. Regular, typical daily health attestation was in place for employees at most airports, with symptom screening for COVID-19, and some were offering COVID testing too. Several of the airports actually altered their work patterns for staff. They staggered shifts, they platooned staff to help reduce cross-contamination and enable contact tracing. With respect to possible transmission via surfaces, airports are investing significant resources in enhanced cleaning and in disinfection, and they're all deploying hand sanitizer stations. Some had sought external accreditation of their cleaning and disinfection protocols to offer a level of independent validation. Some turned to certification programs open to the aviation sector only, and others chose a program recognised outside the sector, and some actually followed both routes.
How do these same protocols, operations, and/or features translate to future pandemic preparedness efforts?
You're right. This is not the first, and it certainly won't be the last pandemic we face together. So what we found was that airports in the study demonstrated substantive understanding of the science and strategies to mitigate disease spread. Senior leadership was visible with efforts to drive engagement throughout the airport community, and many airports had developed comprehensive playbooks on managing the pandemic emergency. So despite the complex conditions in which they are operating, airports in this study made timely, science-based decisions to manage the COVID-19 threat by adopting a layered approach to risk mitigation. Consistency of practices across airport employees, tenants, contractors and visitors is important, as well as making it easier for passengers to understand what's expected of them. And greater harmonisation of practices will support focused investment in risk mitigation measures and help support public confidence in travelling. A key thing here for me was the way that the airport operators worked well with their stakeholder groups, public health teams and the various local and state bodies. And I think these relationships and a better understanding of when public health means business will really stand them in good stead and in a much better state of readiness, or as you say, preparedness to meet the next pandemic.
What can we do to protect ourselves while traveling during a pandemic? Your report suggests that travelers should make a COVID plan. What does that entail?
The first thing is really to avoid travelling if you feel unwell. For COVID-19, it's worth checking your own health before you leave home, and we give a list of the most common symptoms in the report, drawing on the CDC guidelines and also the other research reports. And then it's really about following the science and adopting the risk-reducing behaviours we know that work. Wearing your mask properly, maintaining your distance, adopting good hand hygiene, and avoiding, where possible, congested spaces. And then it's about compliance, following the rules and the protocols, just like we do before COVID-19 when we comply with security measures. The layered approach offers a level of redundancy so that maybe when some practices aren't possible, other mitigation strategies can be optimally applied. We've actually added an easy-to-follow checklist on our website that captures the science-based things that you can do to protect yourself while travelling. So I'd recommend that people use that and think about their COVID travel plan.